Hello, my name is Esme Fuller-Thompson. I'm the director of the Institute for Life Course and Aging at the University of Toronto. We're so fortunate today to have Dr. Irina Nica-Graham with us. Dr. Nica-Graham is a geriatric psychiatrist at Mount Sinai Hospital, and she also is an assistant professor in the Department of Psychiatry here at the University of Toronto. Welcome.
Thank you, Esme. I'm very pleased to be here today and talk about the topic that's close to my heart.
What is PTSD?
Okay. So PTSD, which is the short form for post-traumatic stress disorder, is a disorder that develops in some people who experienced a shocking event, an experience of what we call trauma. And the definition of trauma can be very broad, but the essential part is that the person is exposed to something very threatening or exposed to news of something threatening having happened to close friends or family members, or witnessed something traumatic happen to someone else. The experience of trauma leads to long-lasting consequences in terms of their mental health. We will talk in more detail about what these are. It's important to recognize that some traumas are easily recognized by everyone. So things like war, being a prisoner of war, the Holocaust, massive natural disasters. So people will recognize those as traumas, but there's also more hidden traumas, more insidious traumas. So child abuse, the domestic abuse, so things that are hidden in our communities that we don't speak much about or don't know much about, that can also threaten a person's sense of safety and integrity, both physical and emotional, and it can lead to PTSD.
How do you go about diagnosing PTSD?
The major categories of symptoms that come up are what we call intrusion symptoms. So this is when the details of the past event come back in a very disorganized fashion, often triggered by things in the environment that may or may not be connected in any way with the past trauma. And it can be very distressing memories or fragments of memory that bring also that experience in the body of as if you're back in the past. Flashbacks, which is almost like watching on TV things that happen to you, nightmares. So they can be very distressing and cause the person to feel as if they're back in the traumatic situation. It can cause avoidance. So of course, if something causes you to be upset, you're trying to avoid that. If something hurts, you stay away from it. The problem is that if the triggers for these very distressing symptoms are part of your everyday life and you avoid them, then your life becomes very restricted and limited. And there are people over time who lose their social networks and lose meaningful work and lose going out, places and being active, and they stay at home. And this leads to isolation, loneliness, and a sense of loss of opportunity. Of course, if you've experienced something traumatic that challenged your sense of safety in the world and your trust in other people in cases of interpersonal trauma, then it's possible to develop this long-lasting sense that life is dangerous. Maybe you feel shame or guilt or blame yourself for things that happen, and you carry that with you through time. It's hard to enjoy things, so you're likely to feel down or depressed, or have limited capacity to enjoy things and relationships. Anger can be a problem, especially in men. Substance use problems as a way of kind of self-medicating the symptoms. Anxiety, insomnia. So these are, again, very distressing symptoms that affect one's life. And finally, if you have PTSD, then it's like being in the jungle all the time. So your body is hypervigilant, hyper alert, or it can be brought to that state very quickly by a trigger, and it can cause insomnia, poor concentration. It gets in the way of functioning because it's hard to think of daily things in your life and what you're going to cook for dinner when your body's telling you there's a big threat out there.
As a geriatric psychiatrist, you specialize in working with older adults. Is PTSD in older adults similar? Are there differences with younger populations?
So first of all, trauma is very prevalent, and there've been studies looking at the exposure to trauma for older adults, kind of lifelong. So this large U.S. studies showed that 50 to 90% of the older adults that they interviewed had experienced at least one traumatic event in their life. But not everyone who experiences trauma develops PTSD. So among the older adults, only between 1 and 5% actually had a full PTSD diagnosis. And I think somewhere around 10-15% may endorse subsyndromal PTSD, so they have some symptoms but not enough to meet the criteria for a diagnosis. But they are vulnerable. And again, it can be that they experience traumatic events currently, and that leads to a new PTSD, or things that happen to them now activate PTSD from traumatic events from their past. Among those who experience massive traumas, so veterans of war, prisoners of war, Holocaust survivors, the rate of PTSD is a lot higher, so it can go up to 50%. And so it's important to ask people about what the trauma was and put it in that context. One of the things that happens with older adults is they're more likely to report physical symptoms than emotional symptoms. So, they may complain of insomnia, poor concentration, and you may not quite know what is going on unless you ask.
Are there any day-to-day strategies that we can use to either decrease our risk of developing PTSD or working on getting through PTSD if we have it?
So the best way to avoid PTSD is for everyone to work to reduce the prevalence of trauma. So, working towards keeping people safe, supporting each other when there's natural disasters, in the pandemic, being there for people who struggle a lot, or families who have family members who are ill with COVID, or who have people in long-term care and they're very, very terrified of the potential of them getting sick. So being there for each other and supporting each other and not closing our eyes to the hidden. And very, very important. So what trauma does to the body and the psychological being is that it shakes the sense of safety. So finding ways to bring back a sense of safety, social safety, physical safety is very, very important. So if someone experiences a trauma, then having that environment of safety brought back is very helpful. Acknowledging the trauma, giving a space for victims to actually be able to speak of what they went through, getting support if there's a matter of getting justice, so offering that kind of support, and doing the things that trauma, like doing the reverse of what trauma does, right? So giving a person a sense of agency, helping with making decisions, collaborating, are helpful.
So assuming that we've tried day-to-day strategies at home and still the person is struggling with PTSD, what are next steps? Who should they turn to?
So as with any mental health struggle or psychological struggle, I think it's important to seek help and feel comfortable seeking help, and not turn it into a sign of weakness, or not let the stigma that's out there prevent from seeking help. So mental illness and PTSD is isolating, and so breaking that isolation, getting help, it's very, very helpful for recovery. And I'd say the first person to call and make an appointment would be the family doctor, or the place where the person gets their primary care. And it may be that the person doesn't even realize that this is PTSD, but could be insomnia, could be that they have nightmares. So it is a persistent struggle, emotionally, physical, to go and report it and get help.
So if we contact the family doctor, what kind of treatments are available?
So PTSD is very treatable. There are also specialized treatments for PTSD, both in terms of medications and therapies. So the type of therapies that are available are well studied, there's evidence base for them, and they work in the general population. And although we don't have a lot of studies, including older adults, the clinical practice tells us that they're very effective with older adults as well. So the ones that are most studied are called prolonged exposure therapy, which helps the patients be exposed to traumatic material, but not in a random way, but in a way where they take control over their feelings, over their thinking, over their physiology. And so it helps them tolerate these triggers without necessarily going into that PTSD state. There's cognitive processing therapy, eye movement desensitization and reprocessing therapy, which is known as EMDR for those who are in the know. And there's, of course, cognitive behavior therapy that is trauma focused. And there are medications, mostly antidepressants, but also other type of medications that can help with the hyperarousal and hypervigilance and insomnia, that can help reduce the distress and help engage in therapy better.
So my take-home message is there are effective interventions, they're positive, they're available. The first step is to talk to my family doctor, and that'll get me into the treatment world, and I can access these both medications and therapeutic interventions. And that the more that those of us who are caregivers know about this, the more likelihood that we can help the older adult thrive. I really appreciate this message of hope and this great overview on the topic. Thanks so much for coming today.
Thank you for having me. It was a pleasure to talk to you today.